Addiction is a very profound pathology that ruins lives. We are committed to helping as many people as we can with the dissemination of information to prevent and defeat addiction. We need your help and support to grow and reach a wider audience. Please support us by subscribing to this channel and sharing our videos. Also, you can send us donations on Cash App and PayPal. Links in description. Your support is deeply appreciated. Medication-assisted treatment, MAT. Medication-assisted treatment, MAT, is the use of medications, in combination with counseling and behavioral therapies, to provide a whole patient approach to the treatment of substance use disorders. Medications used in MAT are approved by the Food and Drug Administration, FDA, and MAT programs are clinically driven and tailored to meet each patient's needs. Research shows that a combination of medication and therapy can successfully treat these disorders, and for some people struggling with addiction, MAT can help sustain recovery. MAT is also used to prevent or reduce opioid overdose. MAT is primarily used for the treatment of addiction to opioids such as heroin and prescription pain relievers that contain opiates. The prescribed medication operates to normalize brain chemistry, block the euphoric effects of alcohol and opioids, relieve physiological cravings, and normalize body functions without the negative and euphoric effects of the substance used. MAT effectiveness. In 2018, an estimated 2 million people had an opioid use disorder, which includes prescription pain medication containing opiates and heroin. MAT has proved to be clinically effective and to significantly reduce the need for inpatient detoxification services for these individuals. MAT provides a more comprehensive, individually tailored program of medication and behavioral therapy that address the needs of most patients. The ultimate goal of MAT is full recovery, including the ability to live a self-directed life. This treatment approach has been shown to improve patient survival, increase retention in treatment, decrease illicit opiate use and other criminal activity among people with substance use disorders, increase patients' ability to gain and maintain employment, improve birth outcomes among women who have substance use disorders and are pregnant. Research also shows that these medications and therapies can contribute to lowering a person's risk of contracting HIV or hepatitis C by reducing the potential for relapse. Learn more about substance misuse and how it relates to HIV, AIDS, and viral hepatitis. MAT medications. The Food and Drug Administration, FDA, has approved several different medications to treat alcohol and opioid use disorders. MAT medications relieve the withdrawal symptoms and psychological cravings that cause chemical imbalances in the body. Medications used for MAT are evidence-based treatment options and do not just substitute one drug for another. Methadone used to treat those with a confirmed diagnosis of opioid use disorder can only be dispensed through a certified OTP. Some of the medications used in MAT are controlled substances due to their potential for misuse. Drugs, substances, and certain chemicals used to make drugs are classified by the Drug Enforcement Administration, DEA, into 5 distinct categories, or schedules, depending upon a drug's acceptable medical use and potential for misuse. Alcohol use disorder medications, acamprosate, disulfiram, and naltrexone are the most common drugs used to treat alcohol use disorder. They do not provide a cure for the disorder but are most effective in people who participate in a MAT program. Acamprosate is for people in recovery, who are no longer drinking alcohol and want to avoid drinking. It works to prevent people from drinking alcohol, but it does not prevent withdrawal symptoms after people drink alcohol. It has not been shown to work in people who continue drinking alcohol, consume illicit drugs, and/or engage in prescription drug misuse and abuse. The use of acamprosate typically begins on the 5th day of abstinence, reaching full effectiveness in 5 to 8 days. It is offered in tablet form and taken 3 times a day, preferably at the same time every day. The medication's side effects may include diarrhea, upset stomach, appetite loss, anxiety, dizziness, and difficulty sleeping. Disulfiram treats chronic alcoholism and is most effective in people who have already gone through detoxification or are in the initial stage of abstinence. Offered in a tablet form and taken once a day, disulfiram should never be taken while intoxicated and it should not be taken for at least 12 hours after drinking alcohol. Unpleasant side effects: nausea, headache, vomiting, chest pains, Difficulty breathing can occur as soon as 10 minutes after drinking even a small amount of alcohol and can last for an hour or more. Naltrexone blocks the euphoric effects and feelings of intoxication and allows people with alcohol use disorders to reduce alcohol use and to remain motivated to continue to take the medication, stay in treatment, and avoid relapses. Opioid dependency medications, buprenorphine, methadone, and naltrexone are used to treat opioid use disorders to short-acting opioids such as heroin, morphine, and codeine, as well as semi-synthetic opioids like oxycodone and hydrocodone. These MAT medications are safe to use for months, years, or even a lifetime. As with any medication, consult your doctor before discontinuing use. Buprenorphine suppresses and reduces cravings for opioids. Methadone reduces opioid cravings and withdrawal and blunts or blocks the effects of opioids. Naltrexone blocks the euphoric and sedative effects of opioids and prevents feelings of euphoria. Opioid overdose prevention medication, Naloxone saves lives by reversing the toxic effects of overdose. According to the World Health Organization, WHO, Naloxone is one of a number of medications considered essential to a functioning healthcare system. Naloxone, used to prevent opioid overdose, Naloxone reverses the toxic effects of the overdose. MAT medications and child safety. It's important to remember that if medications are allowed to be kept at home, they must be locked in a safe place away from children. Methadone in its liquid form is colored and is sometimes mistaken for a soft drink. Children who take medications used in MAT may overdose or experience adverse reactions. Prevent children and pets from accidental ingestion by storing it out of reach. For more information, visit CDC's Up and Away educational campaign. For information on how to dispose of medications in your house, refer to FDA's information How to Safely Dispose of Unused or Expired Medicine or DEA's drug disposal web pages. Counseling and behavioral therapies? Under Federal Law 42.CFR 8.12, MAT patients receiving treatment in OTPs must receive counseling, which may include different forms of behavioral therapy. These services are required along with medical, vocational, educational, and other assessment and treatment services. Regardless of what setting MAT is provided in, it is more effective when counseling and other behavioral health therapies are included to provide patients with a whole person approach. Co-occurring disorders and other health conditions. The coexistence of both a substance use disorder and a mental illness, known as a co-occurring disorder, is common among people in MAT. In addition, individuals may have other health-related conditions such as hepatitis, HIV and AIDS. Training and resources. SO offers tools, training, and technical assistance to practitioners in the fields of mental health and substance use disorders. Buprenorphine. What is buprenorphine? Buprenorphine is a medication approved by the Food and Drug Administration, FDA, to treat opioid use disorder, OUD, as a medication-assisted treatment, MAT. As with all medications used in MAT, buprenorphine should be prescribed as part of a comprehensive treatment plan that includes counseling and other behavioral therapies to provide patients with a whole-person approach. Buprenorphine is the first medication to treat OUD that can be prescribed or dispensed in physician offices, significantly increasing access to treatment. The Drug Addiction Treatment Act of 2000, Data 2000, the Comprehensive Addiction and Recovery Act, CARA, and the Substance Use Disorder Prevention Opioid Recovery and Treatment for Patients and Communities, Support, Act allows qualified practitioners to dispense or prescribe buprenorphine for the treatment of opioid use disorders, OUD, in settings other than opioid treatment programs, OTP, upon completion of specialized training. To receive a waiver to administer, dispense, and prescribe buprenorphine, office-based practitioners must notify SUS Center for Substance Abuse Treatment, CSAT, Division of Pharmacologic Therapies, DPT, of their intent to practice this form of medication-assisted treatment, MAT. The NOI must be submitted to SUS before the initial dispensing or prescribing of OUD treatment medication. Recently published practice guidelines have created a training flexibility for the notifications of intent, NOI, to prescribe buprenorphine. 1. In order to apply for subsequent increases in the number of clients eligible for treatment with buprenorphine, office-based providers are obliged to undertake required training activities. Completion of required training accompanies the NOI. This pathway recognizes the importance of specialized training in managing a larger panel of patients who might require treatment with buprenorphine. 2. To expand access to buprenorphine, the practice guidelines for the administration of buprenorphine for treating opioid use disorder exempts eligible physicians, physician assistants, nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists, and certified nurse midwives from the certification requirements related to training, counseling and other ancillary services, that is, psychosocial services, under 21 U.S.C. Section 823G, 2B1-2, of the Controlled Substances Act, CSA. Practitioners utilizing this exemption are limited to treating no more than 30 patients at any one time. Time spent practicing under this exemption will not qualify the practitioner for a higher patient limit. This exemption applies only to the prescription of Schedule III, IV, and V drugs or combinations of such drugs, covered under the CSA, such as buprenorphine. An eligible provider may choose to undertake training, or forego it prior to prescribing buprenorphine. As noted above, those who forego training are limited to treating no more than 30 patients at any one time. In addition, buprenorphine is also administered at certified opioid treatment programs, OTPs. Learn more about certified/accredited OTPs or find a certified OTP in your local area. Several federal laws and regulations permit physicians and other medical personnel to administer medications approved by the Food and Drug Administration, FDA, for the treatment of opioid use disorders, OUD, under special circumstances without a buprenorphine waiver. Buprenorphine offers several benefits to those with OUD and to others for whom treatment in a methadone clinic is not appropriate or is less convenient. The following buprenorphine products are FDA approved for the treatment of OUD. Generic buprenorphine/naloxone sublingual tablets. Buprenorphine sublingual tablets, Subutex. Buprenorphine/naloxone sublingual films, Suboxone. Buprenorphine/naloxone sublingual tablets, Zubsolv. Buprenorphine/naloxone buccal film, Bunavail. Buprenorphine implants, Probufene. Buprenorphine extended release injection, Sublocade. Refer to the individual product websites for a complete listing of drug interactions, warnings, and precautions. How buprenorphine works. Buprenorphine is an opioid partial agonist. It produces effects such as euphoria or respiratory depression at low to moderate doses. With buprenorphine, however, these effects are weaker than full opioid agonists such as methadone and heroin. When taken as prescribed, buprenorphine is safe and effective. Buprenorphine has unique pharmacological properties that help diminish the effects of physical dependency to opioids, such as withdrawal symptoms and cravings. Increase safety in cases of overdose. Lower the potential for misuse. Buprenorphine for opioid use disorder. To begin treatment, an OUD patient must abstain from using opioids for at least 12 to 24 hours and be in the early stages of opioid withdrawal. Patients with opioids in their bloodstream or who are not in the early stages of withdrawal may experience acute withdrawal. After a patient has discontinued or greatly reduced their opioid use, no longer has cravings, and is experiencing few, if any, side effects, if needed, the dose of buprenorphine may be adjusted. Due to the long-acting agent of buprenorphine, once patients are stabilized, it may be possible to switch from everyday to alternate day dosing. The length of time a patient receives buprenorphine is tailored to meet the needs of each patient, and in some cases, treatment can be indefinite. To prevent possible relapse, individuals can engage in ongoing treatment, with or without MAT. Before starting buprenorphine, patients diagnosed with an OUD should talk to their healthcare practitioner before starting treatment with buprenorphine to fully understand the medication and other available treatment options. Common and serious side effects of buprenorphine. Common side effects of buprenorphine include constipation, headache, nausea, and vomiting, dizziness, drowsiness and fatigue, sweating, dry mouth, muscle aches and cramps, inability to sleep, fever, blurred vision or dilated pupils, tremors, palpitations, disturbance in attention. Serious side effects of buprenorphine include respiratory distress, overdose, adrenal insufficiency, dependence, withdrawal, itching, pain, swelling, and nerve damage, implant, pain at injection site, injection, neonatal abstinence syndrome, in newborns. These are not all the side effects of buprenorphine. For more information, patients should talk to their healthcare practitioner or pharmacist. Patients should tell their healthcare practitioner about any side effects that are bothersome, or do not go away. Patients and practitioners are encouraged to report all side effects online to MedWatch, FDA's Medical Product Safety Reporting Program for healthcare professionals, patients, and consumers, or by calling 1-800-332-1088. Safety precautions. People should use the following precautions when taking buprenorphine. Do not take other medications without first consulting your doctor. Do not use illegal drugs, drink alcohol, or take sedatives, tranquilizers, or other drugs that slow breathing. Mixing large amounts of other medications with buprenorphine can lead to overdose or death. Ensure that a physician monitors any liver-related health issues that you may have. Tell your doctor if you are pregnant or plan to become pregnant. Prevent children and pets from accidental ingestion by storing it out of reach. For more information, visit CDC's Up and Away educational campaign. Dispose of unused methadone safely. Talk to your MAT practitioner for guidance, or for more information on the safe disposal of unused medications, visit FDA's Disposal of Unused Medicines or DEA's Drug Disposal webpages. Do not share your buprenorphine with anyone even if they have similar symptoms or suffer from the same condition. Buprenorphine misuse potential. Because of buprenorphine's opioid effects, it can be misused, particularly by people who do not have an opioid dependency. Naloxone is added to buprenorphine to decrease the likelihood of diversion and misuse of the combination drug product. Treating pregnant or breastfeeding women. Buprenorphine may be prescribed to women who are pregnant and have an OUD. Buprenorphine and methadone are considered the treatments of choice for OUD in pregnant and breastfeeding women. Switching from one form of MAT medication to another. Patients may decide to switch from one MAT medication to another based on medical, psychiatric and substance use history, as well as their preferences and treatment availability. As medications are different, patients should talk to their practitioner and understand each medication. Methadone. What is methadone? Methadone is a medication approved by the Food and Drug Administration, FDA, to treat opioid use disorder, OUD, as a medication-assisted treatment, MAT, as well as for pain management. When taken as prescribed, methadone is safe and effective. Methadone helps individuals achieve and sustain recovery and to reclaim active and meaningful lives. Methadone is one component of a comprehensive treatment plan, which includes counseling and other behavioral health therapies to provide patients with a whole-person approach. How does methadone work? Methadone, a long-acting opioid agonist, reduces opioid craving and withdrawal and blunts or blocks the effects of opioids. Methadone, taken daily, is available in liquid, powder and diskettes forms. How can a patient receive methadone? By law, only a certified treatment program, OTP, can dispense methadone for the treatment of OUD. Patients taking methadone to treat OUD must receive the medication under the supervision of a practitioner. After a period of stability, based on progress and proven, consistent compliance with the medication dosage, patients may be allowed to take methadone at home between program visits. The length of time a person receives methadone treatment varies. According to the National Institute on Drug Abuse publication, Principles of Drug Addiction Treatment, a research-based guide, 2012, the length of methadone treatment should be a minimum of 12 months. Some patients may require long-term maintenance. Patients must work with their MAT practitioner to gradually reduce their methadone dosage to prevent withdrawal. Methadone safety. Methadone is safe and effective when taken as prescribed. Methadone medication is specifically tailored for the individual patient, and doses are often adjusted and readjusted, and is never to be shared with or given to others. This is particularly important for patients who take methadone at home and are not required to take medication under direct supervision at an OTP. Patients should share their complete health history with health providers to ensure the safe use of the medication. Other medications may interact with methadone and cause heart conditions. Even after the effects of methadone wear off, the medication's active ingredients remain in the body for much longer. Unintentional overdose is possible if patients do not take methadone as prescribed. The following tips can help achieve the best treatment results. Never use more than the amount prescribed, and always take at the times prescribed. If a dose is missed, or if it feels like it's not working, do not take an extra dose of methadone. Do not consume alcohol while taking methadone. Be careful driving or operating machinery on methadone. Call 911 if too much methadone is taken or if an overdose is suspected. Prevent children and pets from accidental ingestion by storing it out of reach. For more information, visit CDC's Up and Away educational campaign. Store methadone at room temperature and away from light. Do not share your methadone with anyone even if they have similar symptoms or suffer from the same condition. Dispose of unused methadone safely. Talk to your MAT practitioner for guidance, or for more information on the safe disposal of unused medications, visit FDA's Disposal of Unused Medicines or DEA's Drug Disposal webpages. Common and serious side effects of methadone. Common side effects of methadone include restlessness, nausea or vomiting, slow breathing, itchy skin, heavy sweating, constipation, sexual problems. Serious side effects of methadone include: side effects should be taken seriously, as some of them may indicate an emergency. Patients should stop taking methadone and contact a doctor or emergency services right away. Experience difficulty breathing or shallow breathing. Feel lightheaded or faint. Experience hives or a rash, swelling of the face, lips, tongue, or throat. Feel chest pain. Experience a fast or pounding heartbeat. Experience hallucinations or confusion. Patients and practitioners are encouraged to report all side effects online to MedWatch, FDA's Medical Product Safety Reporting Program for healthcare professionals, patients, and consumers, or by calling 1-800-332-1088. Pregnant or breastfeeding women and methadone. Women who are pregnant or breastfeeding can safely take methadone. Comprehensive methadone maintenance treatment should include prenatal care to reduce the risks of complications during pregnancy and at birth. Undergoing methadone maintenance treatment while pregnant does not cause birth defects. Methadone's ability to prevent withdrawal symptoms helps pregnant women better manage their opioid use disorder, OUD, while avoiding health risks to both mother and baby. Pregnant women who experience withdrawal may be at risk of miscarriage or premature birth, as withdrawal can cause the uterus to contract. It is possible that some babies may experience withdrawal, also known as neonatal abstinence syndrome, NAS, after birth. Symptoms may begin within minutes to hours after birth, with most symptoms appearing within 72 hours. It is possible for symptoms to appear as late as up to 2 weeks after birth. It is important to speak with your physician, as NAS is influenced by many factors. Research has shown that the benefits of breastfeeding outweigh the effect of the small amount of methadone that enters the breast milk. Switching from one form of MAT medication to another. Patients may decide to switch from one MAT medication to another based on medical, psychiatric and substance use history, as well as their preferences and treatment availability. As medications are different, patients should talk to their practitioner and understand each medication. Naltrexone. What is Naltrexone? Intramuscular extended-release naltrexone is a medication approved by the Food and Drug Administration, FDA, to treat both opioid use disorder, OUD, and alcohol use disorder, AUD, as a medication-assisted treatment, MAT, option. Naltrexone can be prescribed and administered by any practitioner licensed to prescribe medications, and is available in a pill form for alcohol use disorder or as an extended-release intramuscular injectable for either alcohol and opioid use disorder. A risk evaluation and mitigation strategy, REMS, is required for the long-acting injectable formulation to ensure that the benefits of the drug outweigh its risks. The pill form can be taken daily for AUD, but the extended-release injectable formulation is approved for the treatment of OUD. The pill form is taken daily and the extended-release injectable is administered every 4 weeks, or once a month, by a practitioner. Naltrexone is one component of a comprehensive treatment plan, which includes counseling and other behavioral health therapies to provide patients with a whole-person approach. Naltrexone is not a recommended MAT option for anyone younger than 18 years of age, or for patients experiencing other health conditions. How naltrexone works. Naltrexone is not an opioid, is not addictive, and does not cause withdrawal symptoms with stop of use. Naltrexone blocks the euphoric and sedative effects of opioids such as heroin, morphine, and codeine. Naltrexone binds and blocks opioid receptors and reduces and suppresses opioid cravings. There is no abuse and diversion potential with naltrexone. Naltrexone for opioid use disorder. To reduce the risk of withdrawal symptoms, patients should wait at least 7 days after their last use of short-acting opioids and 10 to 14 days for long-acting opioids, before starting naltrexone. Patients taking naltrexone should not use any other opioids or illicit drugs, drink alcohol, or take sedatives, tranquilizers, or other drugs. Patients should notify their practitioner about all medications they are currently taking as well as any changes in medications while being treated with naltrexone. While the oral formulation will also block opioid receptors, only the long-acting injectable formulation is FDA approved as MAT and requires REMS. Patients on naltrexone, who discontinue use or relapse after a period of abstinence, may have a reduced tolerance to opioids. Therefore, taking the same, or even lower doses of opioids used in the past can cause life-threatening consequences. Naltrexone for alcohol use disorder. When starting naltrexone for AUD, patients must not be physically dependent on alcohol or other substances. To avoid strong side effects such as nausea and vomiting, practitioners typically wait until after the alcohol detox process before administering naltrexone. Naltrexone binds to the endorphin receptors in the body, and blocks the effects and feelings of alcohol. Naltrexone reduces alcohol cravings and the amount of alcohol consumed. Once a patient stops drinking, taking naltrexone helps patients maintain their sobriety. Naltrexone MAT treatment lasts for 3 to 4 months. Practitioners should continue to monitor patients who are no longer taking naltrexone. Before starting naltrexone, patients should talk to their practitioner before starting treatment with naltrexone about the following situations. Current liver problems, use illegal drugs, have hemophilia or other bleeding problems, have kidney problems, or have any other medical conditions. Are pregnant, plan to become pregnant, or are breastfeeding. All medications, prescriptions and non-prescription medicines, vitamins, and herbal supplement. It is important for practitioners to know if patients are currently taking any opioid-containing medicines for pain, cough, colds, or diarrhea. Currently being treated for an OUD or AUD. Are allergic to naltrexone or any of the ingredients or the liquid used to mix the extended-release naltrexone. Common and serious side effects of naltrexone. Common side effects of naltrexone may include nausea, sleepiness, headache, dizziness, vomiting, decreased appetite, painful joints, muscle cramps, cold symptoms, trouble sleeping, toothache. Serious side effects of naltrexone may include risk of opioid overdose. Accidental overdose can happen in 2 ways. Naltrexone blocks the effects of opioids, such as heroin or opioid pain medicines. Patients who try to overcome this blocking effect by taking large amounts of opioids may experience serious injury, coma, or death. After receiving a dose of naltrexone, the blocking effect slowly decreases and completely goes away over time. Patients who are taking naltrexone for an OUD can become more sensitive to the effects of opioids at the dose used before, or even lower amounts. Using opioids while on naltrexone can lead to overdose and death. Patients should tell family and the people they are closest to about the increased sensitivity to opioids and the risk of overdose. Severe reactions at the site of injection. Severe injection site reactions are possible, including tissue death. Some of these reactions have required surgery. Patients should call their practitioner right away if they experience any of following issues of concern at the injection site. Intense pain. The area feels hard. Large area of swelling. Lumps. Blisters. An open wound. A dark scab. Patients should contact their practitioner about any reaction at an injection site that is concerning, gets worse over time, or does not get better within 2 weeks. Liver damage or hepatitis is possible. Patients should tell their practitioner about any of the following symptoms during treatment. Stomach area pain lasting more than a few days. Dark urine. Yellowing of the whites of your eyes. Tiredness. Practitioners may need to stop treatment using naltrexone if patients develop signs or symptoms of a serious liver problem. Depressed mood. Pneumonia. Serious allergic reactions. Skin rash. Swelling of face, eyes, mouth, or tongue or trouble breathing or wheezing. Chest pain. Feeling dizzy or faint. These are not all the side effects of naltrexone. For more information, patients should talk to their practitioner or pharmacist. Patients should tell their practitioner about any side effects that are bothersome, or do not go away. Patients and practitioners are encouraged to report all side effects online to MedWatch, FDA's Medical Product Safety Reporting Program for healthcare professionals, patients, and consumers, or by calling 1-800-332-1088. Patients who should not take naltrexone if they currently use or have a physical dependence on opioid-containing medicines or opioid drugs, such as heroin, or currently experiencing opioid withdrawal symptoms. Experience opioid withdrawal symptoms. Withdrawal symptoms may happen when a patient was taking opioid-containing medicines or opioid drugs regularly and then stopped. Symptoms of opioid withdrawal may include anxiety, sleeplessness, yawning, fever, sweating, teary eyes, runny nose, goosebumps, shakiness, hot or cold flushes, muscle aches, muscle twitches, restlessness, nausea and vomiting, diarrhea, or stomach cramps. Dispose of unused naltrexone safely. Talk to your MAT physician for guidance, or for more information on the safe disposal of unused medications. Visit FDA's Disposal of Unused Medicines or DEA's Drug Disposal webpages. Naloxone. What is naloxone? Naloxone is a medication approved by the Food and Drug Administration, FDA, designed to rapidly reverse opioid overdose. It is an opioid antagonist, meaning that it binds to opioid receptors and can reverse and block the effects of other opioids, such as heroin, morphine, and oxycodone. Administered when a patient is showing signs of opioid overdose, naloxone is a temporary treatment and its effects do not last long. Therefore, it is critical to obtain medical intervention as soon as possible after administering/receiving naloxone. The medication can be given by intranasal spray, into the nose, intramuscular, into the muscle, subcutaneous, under the skin, or intravenous injection. A practitioner should assess the need to prescribe naloxone for patients who are receiving medication-assisted treatment, MAT, or otherwise considered a risk for opioid overdose. Candidates for naloxone are those who take high doses of opioids for long-term management of chronic pain, receive rotating opioid medication regimens, have been discharged from emergency medical care following opioid poisoning or intoxication, take certain extended-release or long-acting opioid medication, Those who have had a period of abstinence to include those recently released from incarceration. Pregnant women can be safely given naloxone in limited doses under the supervision of a doctor. A doctor or pharmacist can show patients, their family members, or caregivers how to administer naloxone. Patients given an automatic injection device or nasal spray should keep the item available at all times. It is important to remember to replace medication when the expiration date passes and if exposed to temperatures below 39 Fahrenheit or above 104 Fahrenheit. Naloxone is effective if opioids are misused in combination with other sedatives or stimulants. It is not effective in treating overdoses of benzodiazepines or stimulant overdoses involving cocaine and amphetamines. Side effects of naloxone. Patients who experience an allergic reaction from naloxone, such as hives or swelling in the face, lips, or throat, should seek medical help immediately. They should not drive or perform other potentially unsafe tasks. Use of naloxone causes symptoms of opioid withdrawal. Medical assistance must be obtained as soon as possible after administering/receiving naloxone. Opioid withdrawal symptoms include feeling nervous, restless, or irritable, body aches, dizziness or weakness, diarrhea, stomach pain, or nausea, fever, chills, or goosebumps, sneezing or runny nose in the absence of a cold. Opioid overdose. Opioid overdose can happen when a patient misunderstands the directions for use, accidentally takes an extra dose, or deliberately misuses a prescription opioid. With illicit drug use. If a person takes opioid medications prescribed for someone else. If a person mixes opioids with other medications, alcohol, or over-the-counter drugs. Signs of opioid overdose. Person does not wake or respond to touch or voice. Breathing is not normal, very slow, or has stopped. Pinpoint-sized pupils. Bluish lips and nose. Opioid overdose is life-threatening and requires immediate emergency attention. Recognizing the signs of opioid overdose is essential to saving lives. SA's efforts to expand the use of naloxone. SA continues to work with its federal partners, states, first responders, and other stakeholders to educate on the use of and increase access to naloxone. In an effort to save more lives from opioid overdose, SA published the Opioid Overdose Prevention Toolkit in 2018. The toolkit equips communities and local governments with material to develop policies and practices to help prevent opioid-related overdoses and deaths. It also serves as a foundation for educating and training communities. Prescribers of opioid pain medications. First responders. Patients who are prescribed opioid medications. Individuals and family members who have experienced an opioid overdose.